Okay, Jen, so we're here today because you say that um, people tell you often that you talk too loudly. Is that the case?
Yes, I would say, I've heard that from more than a couple people. Yes.
Okay, yeah, and listening to you now, I would say that it's a little louder than a typical conversational level, and that's something we definitely want to be aware of. There's also a lot of effort in your voice, so when you're loud like that, there's lots of effort, lots going on. Is that tiring for you? Do you ever have any pain or anything like that, or get hoarse?
Well, actually, yeah, I would say by the end of the day, my voice is a little tired. It's a
Okay,
little hoarse. Yeah,
okay, uh huh,
I would
yeah,
say that.
okay, yeah. So, with all that in mind, today we're going to work on something called confidential voice. Okay, so our goal is going to be to bring your volume way down. It's also going to slow you down. Um, it's going to require some more breath support. It's going to relax things in general. Um, so, when we think about levels of volume for our voice, there are kind of five basic volume levels for the voice. There's a whisper, there's a light, breathy voice. There's a normal conversational voice.
Hmm.
There's a louder, more projected voice, and then there's yelling. Okay, so basically, we don't want to go anywhere near yelling. Um, that's really not good for your voice to do that. I would say you often approach, it sounds like you often approach, and from talking to you, that kind of louder projected voice. That's actually, and you saying that you tend to, get tired, your voice gets tired, hoarse by the end of the day. That's not great either for your voice. Where a good place to live is the normal conversational voice. But to do that, to get you comfortable with that, we're going to actually go even a step down from that and work on the light, breathy voice, which is the confidential voice. Okay, so like I said, we're going to bring the volume down. It's going to slow you down. It's going to relax things and it's a lighter, breathier voice. So it actually you're going to be using more air doing that. So just know that when we talk in this kind of voice, um, you're going to probably have to take some extra breaths. If you're using the same number of breaths that you were before or you would otherwise, you're going to run out of air by the end and you're going to strain. Okay, um, so let's practice. That's the best way is to jump in. And I'll start. And so I think I did a little bit before, but this is the voice we're going to talk in. It's our confidential voice, and the name basically, I think, is kind of suggestive of the voice you might use if you're at a top secret meeting at a cafe with somebody and a whisper. You might not hear even each other. You got to project a little bit, but you got something real confidential you want to pass along. Or you're in a room, say, with a baby sleeping, and you don't want to wake that baby. You're going to speak in that light, breathy voice. You can probably talk a little bit above a whisper, but light, breathy voice so you don't wake the baby up. Okay, so why don't you practice with me now? Okay, let's see if this comes easy for you. Some people, most people, it does. Some people have it takes a little bit of work. So, Jen, why don't you tell me a little bit in the confidential voice about what you do?
Okay. I work as a labor and delivery nurse.
Okay.
I've been doing that for 8 years now, and I really enjoy it. And I only work about 2 days a week now, though.
Okay. Okay,
Is that
great.
good?
No, that is, yeah, that is good. That's great because I would say that you kind of hit the nail on the head there with the light, breathy voice. It wasn't quite a whisper if you're talking like this, a whisper. Because believe it or not, a whisper actually is really not great for your voice. Um, so we don't want to be there, but you were that step above. So that's great. Let's try one other thing in our confidential voice again. Jen, can you tell me a little bit about your family?
Yes, I have a husband,
Okay.
and we have been married for 6 years. We have a daughter who's 3, who's currently doing really well and
Mm-hmm.
about to go to preschool.
Good.
And then 4.5 months ago, we had a little baby girl named Lena.
Okay.
Yes.
Well, great. Well, that's great. That you, like I said, you hit the nail on the head there. Um, that's where you want to be. That's actually where I want you to live for the next couple of weeks. Not forever and ever. Like I said before, the end goal is to be at that normal conversational level.
Right.
But to do that, to reach that normal conversational level, I think, to kind of break up where you've been for so long, at that louder projected voice, we've got to really bring it down to
Okay.
break that up.
Okay.
So when at all possible, over the next 3 weeks, let's
Okay.
say, I'd like you to use the confidential voice. Obviously, I know there are situations where that's not going to be possible. When you're in, your hospital setting and a doctor comes up to you in an urgent situation in a noisy room and asks for the patient status, I know you're not going to say, well, the heart rate is approximately 85 beats per minute. I know, yeah. So, yeah, where appropriate, when you can, I want you to do that confidential voice. And most people say they find actually that it's easier, it's less work. All the talking loud, that takes a lot of effort. And it seems like a lot of work actually to think about having to do this. But people come back and say that, man, I had no idea how hard I was working before. This is way easier. So we're going to try this for the next couple of weeks.
That sounds great.
Okay.
Thanks.
Mm-hmm.